Welcome to another alumni career conversation. I'm Bryan Kanney, and today I have the pleasure of introducing Viveka Prakash-Zawisza. And Viveka is a 2019 graduate of both the MBA and MS Global Health Policy Management programs. So, welcome to the series. Thank you for being here today, and I hope that you find this lovely Zoom box to your satisfaction.
It's what we have, and we're making it work. It's good.
Yeah, that's totally make it work. That's
Yes.
our heads are down. We're ready to get over 2020. Great. So again, thank you so much for being here today. I thought we would start the conversation. I know that we've talked about this a little bit previously, but ultimately you chose to attend both the MS Global Health Policy Management program and the MBA program. So I'm just wondering about your thought process, your decision-making process, because I know you also maintain an interest in the Executive MBA for Physicians program at Heller. So genuinely curious about your decision-making process and fit, essentially.
Yeah, absolutely. I'm happy to talk about that. So as you said, so when I first reached out to Heller expressing interest in wanting to attend, I learned about both the Executive MBA for Physicians, since I am a physician, but I was also very intrigued by this option of this dual degree. The reason I chose the latter was that for a couple of reasons. One was that I really wanted a very comprehensive MBA experience, and I wanted skills and knowledge that would extend beyond the healthcare sector.
Mm.
I also wanted to be exposed to people who weren't in healthcare, and I wanted that diversity among my classmates and in the classroom. And then the adding on the global health piece was important to me because, and this was what how it was explained to me, and in fact was my experience, is that in a way the master's in global health policy was very similar to an MPH. It's not an MPH, but it has a lot of the similar elements to it, and that was appealing to me as well. That it would be sort of a more scientifically rigorous curriculum to sort of counterbalance the MBA as well. And as we've discussed too, I'm a domestic practitioner. I'm American. This is where I live and work, but I have worked overseas in healthcare. I hope to do that again in the future. So I wanted that global lens, and as we've said too, applying that global lens to American healthcare has actually been a really important skill to have. So that what drew me to it was that experience, the opportunity to experience a lot of diversity of thoughts and backgrounds.
Yeah. So I really appreciate your intention, your proactive approach, right? So being very intentional about which program will suit which programs in this case would suit you best for your future career goals. So that's fantastic. But if we fast forward, you find yourself as medical director at Mass Health. So I'm wondering if you would talk about your role, your impact, and how the programs helped prepare you for this role.
Yes, absolutely. So as a medical director, my role, so medical directors at any health insurance company, Mass Health is a Medicaid agency. Medicaid is a form of public health insurance. So medical directors at any sort of an insurance company tend to be traditionally have a role of making sure that any of those coverage policies at that insurance company and other things are, make sense from a clinical perspective and are fair and appropriate. So that's definitely part of my job. But what's really exciting about being at a Medicaid agency is that there's so much beyond that I get to do. And I get to be at the table when we're shaping policy that affects everybody in the state and their health. We work very closely with the Department of Public Health. It's a sister agency to us. And it's been a really rich experience. So I would say I get to apply both my MBA skills and my global health skills every day. The MBA definitely comes in because, again, we are an insurance company. We talk a lot about finances, payment structures. There's also a lot of just organizational pieces about just operations that we think about. So that's really rewarding and satisfying. And then the global health piece comes in when we're actually talking about the policies themselves. And I am able to sort of say, well, for example, when we talk about, using COVID as an example, we're talking about vaccine access to vaccines. And so I feel like I can come to the table and say, well, in other countries, they have programs in place to improve access. They have mobile vans, or they have, local clinics in neighborhoods that are underserved. And I'm able to sort of bring those ideas to the table in this sort of out of the box way. And that feels very rewarding as well. So I definitely get to use both sides of my Heller experience.
Yeah, to me, the fit is very clear, these two programs for your current role, for how you see your professional career developing. So I think it makes perfect sense. Thank you so much for sharing that.
Yeah, of course.
I am curious though, technically you work for Mass Health, but you're
Yeah.
in the Massachusetts Executive Office of Health and Human Services. Can you explain how that is?
What that is? Yeah, sure. Yeah, I had to learn all of this myself too. And it's government.
Okay.
So within the state government structure, so there's just like on the federal level, there's an executive, legislative, and judicial branch within the state, as it is in every state in this union. So the executive branch, which the governor is the head of, within that there are these executive agencies. I don't know what they all are, so I don't pop quiz me on that. But one of those agencies is the Executive Office of Health and Human Services, which is currently overseen by Secretary Mary Lou Sudders. I believe it's probably one of the largest executive agencies, if not the largest. It's very broad. Don't quote me on that. I might be wrong, but I'm under the impression it's a very large agency. And so
I give you all the credit.
within that, there are many, many sister agencies. So Mass Health is one. So Mass Health administers the state Medicaid plan. Department of Public Health is another one. Department of Children and Families, Department of Mental Health. There's a number of them. So I work for Mass Health, but Mass Health is an agency under the umbrella of the Executive Office of Health and Human Services. So if that.
Yeah, that's helpful to me. I'm just wondering, students who are interested, like, oh, I'm considering Mass Health as an employer, but how is it that Viveka is in the Executive Office of Health and Human Services, but her employer is Mass Health?
Yeah, so what I would say is if you're interested in working for the Executive Office of Health and Human Services, there probably are roles at that executive level that I think you could apply for. Those would probably be more, I'm guessing, more like administrative roles, maybe some policy type roles. But really the bulk of the work is done at these individual agencies. And so then it would be a matter of deciding which agency would be the one that appeals to you. If you're very committed to children and families, then that would be the way, or disabilities, or elder affairs, whatever it might be. So then you would I would advise focusing on the agency that provides that more targeted set of services. More rather than just that executive office itself. But as I said, there are certainly jobs available at that executive office level too.
Yeah, that's very helpful. Thank you. I know that's
Yeah.
complicated. Lots
Government
of pieces. Yeah, government.
right.
So on that note, thinking about public-private sector, I'm wondering what observations you have. You're in the public sector, you're working for the government. What observations do you have about how public and private sectors might be different?
That's a great question. And I'm lucky because prior to coming to Heller, I worked for 5 years for a private healthcare organization. And so I have had I have experience in both. And so I have a lot of observations about that. And I think everything's a trade-off. One of the things I love about where I work now, and Heller absolutely sort of stirred this within me, and it's something that is very important to me, is to be in a place that's mission driven. So that is, for me, such an important trade-off. So I think for the most part, my impression is that in a public sector position, you are going to find more mission driven companies, and your coworkers similarly are going to be focused that way. Private sector, I'm not, obviously there's plenty of good work that happens there. It's just not the same. It's going to be much more about the profit, the bottom line.
Mm,
And the trade-off there is that you do get a lot more perks.
mm,
When in my previous job, there were, things I could get reimbursed for. There were, all kinds of things. The particular job I had, I was a salaried employee. I was a physician, but I was salaried, and I just didn't have to think about punching in and out or reporting my hours. It's just different. And there's a different level of accountability. In government, we're accountable in so many ways to the public, as we should be. Similarly, I have to be very careful about what I say and who I say it to and how I frame it. So in those ways, there's a lot of differences. And I think you're asking a great question. And I think it is important for people to be aware that neither is good or bad. They're just different. And you might want different things at different times in your life. And for now, this is rewarding to me. This is what gets me out of bed. One day I may feel like I'm tired of having to watch what I say. I'm tired of having to log my hours every week. I just want to go to work and not think about it. So, but that if I was to sort of summarize the differences, that's how I would frame it.
that's great. I find myself having conversations with students about one, self-awareness, but two, really determining what's an appropriate fit right now, understanding that once you start working in the public sector, we'll say you'll learn more about yourself. You might grow frustrated or excited or happy about certain aspects, and then you move into public sector or private sector maybe. So, there are changes that happen. You might find yourself leaning one way or the other, or constantly sort of going between. But I always emphasize self-awareness and really doing a level of assessment. Where do you think that you fit?
Right.
So that's your insight is very helpful as well. Thank you.
Of course. Yeah. And I think the other thing to remind people is, especially when I talk to people who are at the beginning of their careers out of school, is don't feel like that first job is the job. It's okay if it's not perfect. It's actually a great opportunity if there are things that are not great about it, because that'll help you learn that self-awareness and what's important to you. And, it's okay. And you don't have to stress out that this has to be perfect, because it's not going to be, nor should it be.
Absolutely. Can I call you up when I have appointments and you you re-emphasize what I say? That's great.
Absolutely.
Thank you.
I can be your little in the background. Yes.
Or you see my that's easy button, or the Viveka button.
Anytime. Happy to help.
Perfect. I see it coming together. I would really be remiss if we didn't sort of address an obvious in the room, talking about COVID and how COVID may have impacted your daily work. What insight do you have there?
Yeah. So great question. And absolutely, we can't not talk about COVID. I would say it's impacted my daily work in some ways that probably are similar to everyone, and other ways that may be a little bit different. So of course, the number one thing being that, I don't work in an office anymore. I work in my house, which is trade-offs. But the ways, and that's, I think, a universal experience. It's interesting because it's I say trade-offs, but some of them are good. This is a reality of government. We work in a government building downtown, not a lot of space. So often scheduling meetings was, not always easy because there weren't a lot of rooms available. And certainly some government agencies have more space than others. But now, because it's all virtual, I'm actually finding I'm getting a lot more done because we can just meet virtually and move things forward. So I think in that sense, productivity has been good. And that's not universal, but overall, that's been my experience. But the ways in which it's been sort of more specific to our job is that, again, as a Medicaid agency, we have to really think about how is COVID impacting the members we serve. And Medicaid, as some folks may know, but it's worth calling out, Medicaid serves about 1 in 4 people in the Commonwealth. So we're a fairly large payer. And the people we serve tend to have very specific needs around social issues, and they need a lot of support in other areas of their lives. Many of them have housing insecurity, food insecurity, unemployment, among many other things. Many of them, are not native English speakers. So it's a very complex and unique population. And so we have to think about how does COVID specifically impact these people and how do we help them and make sure our policies are the right ones. And I mentioned before too, we work very closely with the Department of Public Health. So that partnership has also been strengthened under COVID. We've been able to help advise the COVID Command Center at DPH in some ways, again, just around developing different policies. We're often the ones who come to the table and say, you know, let's think about the way these materials, communication materials, for example, around testing and contact tracing, are we framing it in a way that's accessible to everybody? Are we, you know, making sure we're not stigmatizing certain groups? The other thing that folks may be aware of, and if you're not, you should be, is that COVID is affecting different racial and ethnic groups disparately. We are finding that Black and Hispanic folks are not only getting more cases, but are also dying from COVID at a higher rate. That's very concerning, and it's something that we want to pay a lot of attention to. So because of all of that, the stuff I was working on pre-COVID is still going and still stuff I have to work on, but now there's this other really big focus that we need to shift to. So my days have only gotten busier. I am not one of those people who is learning a new language or redesigning my kitchen right now. So I'm very jealous of the people who get to do that. That's not my life.
Well, we appreciate your dedication to this issue, which is concerning nevertheless. So I'm sorry that you can't update your kitchen, but thank you for focusing on the people of Massachusetts.
I'm okay with the trade-off.
Yeah. I suppose outside of COVID, is there anything in the world of health that maybe students should be made aware of, or the general Heller community?
Well, I think, you know, the good thing is I think the types of people who come to Heller and who teach at Heller are very aware of, you know, all of the landscape of American politics and American justice and injustice, as we know. So I think my experience was, you know, as I mentioned to it, one of the things I enjoyed so much in my MBA program was being with people who were not in healthcare. But even then they had the conversations I had, they had a really high level of awareness that healthcare in America is in crisis. COVID has only exacerbated all those underlying issues. And so there's plenty of work to be done, particularly around policy. I think there's a lot that we're going to see play out as the whole picture of COVID evolves. You know, as you've probably been reading, there are people who get COVID who need weeks or even months of recovery. And so while the deaths that's one major problem, there's also this group of folks who survive but who need ongoing care. That's going to start stressing the healthcare system out too. So there's plenty of work to be done. There's many different ways to help. And I think healthcare is always, you're going to have a lot of job security if you go into healthcare, and you also can make a really big impact. So I really encourage people to consider it as a career option. And even if the other thing too is I think you can really apply skills from a broad set of backgrounds to healthcare. And actually sometimes that's a good thing, with having someone who isn't entrenched in healthcare coming in with a fresh set of eyes. So yes, and I think this dual degree was really well, it's a well-designed dual degree, and it positions you well to do that.
That's great. Speaking of the dual degrees, I'm wondering, I'll make this the last question, but
it's fine.
What advice would you give to students in either or both the MBA or global health programs? They're different programs. Global health is 9 months. The MBA program, I understand, is 2 years. I
think it's technically 18 months or 19 or 20 months. It's something like that. Yeah.
So it's longer.
Yes. Yes.
I'm wondering what advice, career advice specifically, you might offer to the students in those programs.
Yeah, as you said, they're different. But I think, you know, the number one thing I would say is what I said previously. Don't feel like your first job out of grad school has to be it. Even for me, you know, I had this whole career before coming to Heller, but I was looking to make a change, and in a way that actually was a good thing, that I was very open-minded about what my next job was going to look like. And so I think I would say that's my big advice, and that applies to both cohorts. Um, and then I would say for the MBA, a really good piece of advice I got from someone when I was in the middle of my career search was that the degrees are important and they're helpful, but they're tools. And so ultimately, being able to back up your academic knowledge with experience is really important. And so, I think the nice thing again with Heller is folks tend to either have had careers before or some other type of experience before coming to grad school, and I think that's actually a good thing, and you should leverage that. Erica is, I feel like, a master at this. She always would give such good advice about how do you frame what you've done in your life before Heller and pull out those skills that are going to be relevant to the job you're applying for. And I think that's so key. And Erica's a great resource, you are as well, to work with people to do that. And don't sort of talk yourself out of something thinking, oh, well, I don't know how to do that, because you probably do. And it's just reframing what you already know. And so that's the other piece is, leverage your experience, leverage what you have done and what you know how to do, and don't doubt yourself. Don't sell yourself short. I suffer a lot from imposter syndrome, which people find hard to believe. They're like, how do you have all these degrees and experience? But I often am in rooms and I feel like I don't know what I'm doing. And so I say that to just normalize that everyone, Michelle Obama has been open that she feels that way, which made me feel better. Oh my gosh, if Michelle Obama has imposter syndrome, wow. But what's important to learn about that is that you have control over that and recognize it and say, no, like, I deserve to be here. I deserve these things. I'm smart and capable. And the Heller degrees are only going to add to your credibility too. And so just believe in yourself, I guess, is the warm, fuzzy takeaway there.
Yeah, it's really important to come across as confident and assured of who you are when you're in that interview process. But two pieces I just want to reiterate that you mentioned is that in a recession economy especially, it's most important to be as flexible as possible without losing sight of your ultimate career goals. It just requires a bit more flexibility, whether that's location, industry, sector, role. You really have to be flexible. And again, that first opportunity doesn't mean it's forever, but
Yes.
definitely an opportunity to gain relevant experience. And this is something we hear from employers time and time again, is that yes, a degree is a piece of the overall qualifications,
Right.
but they're primarily interested in skill sets. So
Exactly. Yep.
you've highlighted the major pieces that I find myself talking about with students directly. So it's good to hear it
Yeah.
from someone in the field. So I feel good about myself. Thank you.
You should. Yes. Well, I feel good too, then, that I'm also, the things I'm learning are in fact universal and sort of best practices too. So, yeah.
Well, Viveka, you're a gem. I appreciate the time that you've taken to meet with us today in the Alumni Career Conversation series. So again, just thank you for your insight, your knowledge, and for always being willing to be a partner with the Heller Career Development Center. So thank you so much.
Well, it was my pleasure. And thank you so much for including me.